SBAR, Interpersonal Communication by Matthew McGregor, John Ng, and Christine Wynn. SBAR is a structured approach that allows you to concisely get across all the information with as little miscommunication as possible. To start off, you give the situation, or S, essentially what is happening at the present time. This includes your name, title, the patient's name, date of birth, and the current situation. Next is B for background. What are the circumstances leading up to this situation? Also includes any lab values, vital signs, and recent medications. A is for assessment. What do I think the problem is? It's important to be specific. R is for recommendation. What should we do to the current problem? Offer where you think needs to be done or ordered to best resolve the situation. Now we'll look at a situation that does not utilize SBAR.
Oh, hi, Dr. McCarthy. Do you have a second?
A second?
Sorry, I just wanted to talk about Mrs. Holmes.
What's up?
Well, I spoke with nursing after rounds today. I was wondering if we should change her pain medication.
I'm sorry, who are you?
Oh, I'm John, the pharmacist on the stroke unit while Tanya's away.
Why change her medication, John? Why wouldn't we just up the dose?
Well, the current med isn't fully relieving her pain, and the team says it's making her drowsy, too tired for her therapies. She's reporting her pain at 7 out of 10 for the last
Okay, what are you suggesting?
Well, I don't really know this patient very well. I could review her chart, but that might take a while. I'm not going to be here tomorrow. Tanya's coming back, so maybe this should wait. But Mrs. Holmes is really hoping to be home for the weekend, some big anniversary, and her husband is coming in this Thursday, so maybe one of us should talk with him.
Okay.
Disappointed!
Now, let's quickly go over what John did wrong. First, he failed to introduce himself or his position, which left the doctor slightly confused and distracted. Secondly, he is ill-prepared and is just speaking about patient details without any particular focus and even loses his place halfway through. Thirdly, he comes with a problem but only a vague recommendation about what should be done, and even then, he doesn't seem very certain about it. Lastly, he also fails to properly determine when a follow-up with the patient should happen and who should handle it. Now, let's give John a second chance and see if he can improve himself with a little more structure in his conversation with the doctor.
Hi, Dr. McCarthy. Is this a good time? I need 3 minutes to discuss Mrs. Holmes. I'm John. I'm providing pharmacy coverage to the unit.
I have a few minutes. What's up?
Nursing raised a concern from rounds this morning. The situation is that Mrs. Holmes' pain isn't being well controlled. She's sedated, which is having an impact on her participation in therapies, and she's continually reporting her pain at 7 out of 10. Now, the background is that she's fallen 3 times since her admission to rehab, and she's requesting to go home at her first pass this weekend, some big family anniversary. But my assessment is that we are not adequately controlling her pain, and what we're giving her is contributing to these falls.
Okay, so what do you recommend?
Well, after reviewing her chart, I'm considering lowering her dose of opiates and introducing an anti-inflammatory, which would be less sedating, and she should be able to tolerate.
Yeah, that makes sense.
Her husband is coming in this Thursday at 10. If you're available, we could meet to discuss.
Okay, sounds like a good plan. Let's meet back here and we'll talk to the family together. Okay.
Good job, John. The SBAR's format allows John to remain calm and confident because he came into the situation with a plan.
As pharmacists, our role includes, but is not limited to, maintaining the quality of the medicines supplied to patients, ensuring that the supply of medicines occurs within the limits of the law, ensuring that medications prescribed by medical providers is appropriate, making OTC recommendations in response to patient symptoms when appropriate, and advising other healthcare professionals on the safe and effective use of medications.
In addition to diagnosing and creating treatment plans to maintain or restore a patient's oral health, a dentist may also screen patients for oral systemic diseases in the clinic by assessing metrics such as blood pressure, tobacco use, diabetes status, among others. They may refer patients to other healthcare providers for unmet primary care needs, educate patients about disease prevention and management, ensure safe administration of anesthetics, and monitoring medications and identifying drug therapy problems.
Since SBAR is a standardized format, it is an effective form of communication that is understood between professions. Utilizing SBAR, one can minimize medical errors that can arise from the breakdown of proper communication.